Let's bring back in Dr. Frank Illuzzi. He's the medical director of specialty services at Hartford HealthCare. Doctor, thank you for being with us here. Let's talk about Vegas and travel in general. That means social distancing is going to be waning in many areas. What should we be doing when traveling within the U.S. right now? Obviously, there's a whole big pent-up demand to, get out there again.
Absolutely. So believe me, I understand, where everybody feels. This has been a very, very long year. And as we see the numbers come down, people want to get out and they want to enjoy themselves again. I don't mean to be redundant, but I think, the best way of protecting yourself is to get that vaccine. The vaccines have proven to be very effective at preventing you from getting the illness. If you are traveling, I know the airlines still have regulations in place. You have to wear your mask while you're on the flights. I know there's been news reports of people being very upset about this and taking it out on the flight attendants. First of all, it's not the flight attendant's call, but everybody needs to wear their mask on the plane. In addition, when you get to where you're going, you have to understand that the other people, if you're vaccinated, the other people there might not be vaccinated. So, you might want to try and do, open air, eating outside and try and limit the amount of times that you're in an enclosed environment with a lot of other people.
There's still a bit of a risk-reward calculation for everybody, despite the low numbers. Now, doctor, as more places reopen, restrictions are being lifted, people are getting outside. But tonight there's a warning from the U.S. Surgeon General, Vivek Murthy, who says the time many people spend in isolation could lead to another epidemic, loneliness. Take a listen.
That loneliness is that it's linked to not only increases in depression and anxiety, but to shorter lifespans, to an increase in premature death, to increased incidence of dementia, to sleep disturbances, and so many other conditions.
Doctor, I think we've all felt that to a certain extent, but obviously for some people, it is really at a heightened level right now. What are some of the warning signs we should look out for our loved ones and also for ourselves? Sometimes people don't realize it.
No, absolutely. I completely agree with Dr. Murthy. I'm an emergency physician, so even in my practice, I'm seeing patients coming in with increased anxiety, increased depressive symptoms. Things that you want to look for are changes in behavior, changes in sleep pattern, changes in eating habits, loss of interest in things that people like to do, not calling back or reaching out to other people, being withdrawn. Having what we call as a poor psychomotor type response where people just look down and they don't maintain eye contact. Anything that's changing in, your loved ones that you're concerned of, please reach out to your primary care provider. Please reach out, to your emergency department or somebody who you trust. And please reach out for help because the help is out there. We do want to help people. But obviously with the year that we've had so far, this is a problem that is now coming to a head and we have to deal with it in an appropriate fashion.
Doctor, are you concerned that some people may get lost in the shuffle, so to speak, especially as we have so many now being able to take masks off and go out again? People may feel badly if they're not quite ready to do that. There's a certain anxiety there for some to remove the mask, even if they are fully vaccinated, etc.
I think that's a very good point and one well taken. I think we have to be appreciative of where other people are. Some people are not ready to take off the mask, and I think it's important for us as a society to allow people their comfort zone. If they're not ready to take off the mask, then I think that's completely appropriate that they continue to wear the mask. If you've been vaccinated and the CDC recommends that you can take off your mask when you're doing daily activities, then you can go ahead and do that. I think it's very important that as we transition back to normal, that we give each other a lot of leeway and we try and be, nicer to each other than we've been in the last couple of years.
That's very true. Doctor, I want to ask you real quickly about what's happening in China right now. A confirmed case of the bird flu H10N3. A 41-year-old man lives north of Shanghai, hospitalized back in April. He's in stable condition, doctor. The Chinese government says the risk of large-scale spread is low. But when you hear about this kind of thing, obviously nerves get rattled very easily these days. What can you tell us?
Well, I think this highlights that we're in a global community, and we have to keep our vigilance up. This is how animal zoonotic diseases jump and come into human beings. And we have to have adequate surveillance. We have to do the appropriate science. And then we have to be transparent with information and give it across borders. So this way we're ready for it. I mean, I remember, back in, when I was starting out my career, when we had the H1N1, the 2003 virus, and how that nearly caused a global pandemic.
Right.
I've lived through H1N1, and now we've had the coronavirus pandemic. These are going to happen from time to time. So it's just a matter of maintaining our vigilance and being very transparent with the communication of what this disease entails.
All right, Dr. Illuzzi, thank you so much for your time. We appreciate it. And there's more to come here on The New Normal on News 12. We'll be right back.